Everybody can see the slides?
Yes.
Okay, perfect. Hoso Natanawe Makanuk Mashik Maunuyak Mamache Toak Aswisian Kenyaku Awasan Totem. Good afternoon, everybody. I'm Angela Fernandez, and I'm a program officer at the National Institute on Minority Health and Health Disparities, Division of Community Health and Population Sciences. And I'm from the Menominee Nation of Wisconsin, and I introduced myself in my language. NIH also sits on the ancestral homelands of the Piscataway Conoy people. And my colleague, Dr. Loud, and I will present a technical assistance webinar to help you understand the different aspects of the funding announcement titled Limited Competition, NIMHD Initiative for Improving American Indian and Alaska Native Cancer Outcomes, U19 Clinical Trial Optional. At the conclusion of the presentation, Dr. Nathan Stinson will be answering selected frequently asked questions and taking your questions sent to the webinar chat. Here are a few housekeeping notes. Please mute your audio and keep your video off. Submit your questions in the chat. At the end of the presentation, we will have a Q&A session, and we will try to get to as many questions as time permits. The video and slides will be posted on the NIMHD website within 1 week. Here are the topics we plan to cover: background goals of the RFA, information on what goes into the application package, how the peer review will be done, the timeline, and the frequently asked questions that we have received, followed by your questions. Part 1, RFA background. American Indian and Alaska Natives experience overall cancer incidence and mortality rates strikingly higher than the overall U.S. population. Resiliencies and strengths within Native communities and individuals have been drawn upon to improve cancer health outcomes. The purpose of this notice of funding opportunity is to support research, including education, outreach, and clinical access to improve the screening, diagnosis, and treatment of cancers in culturally respectful and practical ways among American Indians and Alaska Natives, particularly those living in rural communities. Authorized by Fiscal Year 2024 Federal Appropriations, Public Law 118.47, further Consolidated Appropriations Act of 2024, this funding opportunity is intended to address the overall cancer incidence and mortality disparities among American Indian and Alaska Native populations, with the goal of making findings applicable and impactful in improving cancer outcomes for patients and their families. The initiative is to be located at an NCI-designated cancer centers or centers with demonstrated partnerships with tribal nations, tribal organizations, and urban Indian organizations to lead innovative and impactful efforts to improve the screening, diagnosis, and treatment of cancers. Interventions that are theoretically grounded and built upon Indigenous knowledge and empirical evidence are needed to promote health, to prevent and treat disease, and to support recovery. Given continued disparities in service access and quality and in disease outcomes, additional efforts are needed to advance dissemination and implementation science relevant to American Indian and Alaska Native communities. There is a need for research to identify, understand, and develop strategies for overcoming barriers to the adoption, adaptation, integration, scale-up, and sustainability of evidence-based interventions, tools, policies, and guidelines that can improve cancer outcomes for American Indian and Alaska Native populations. The goal of this NOFO is to seek input from tribal nations and organizations in the development of this initiative. And NIMHD held the following listening sessions and consultation for guidance on research priorities and approaches on the improvement of cancer outcomes. On April 24th, there was a tribal listening session at the NIH Tribal Advisory Committee, or TAC meeting. On the 7th to 8th of May, the Health and Human Services Secretary's Tribal Advisory, or STAC meeting was held. On the 22nd of May, the Tribal Health Research Office helped us to hold a tribal consultation, which can be found at this link, and forthcoming is the Tribal Consultation Report. Part 2, Application Information. Here's some key information. Only one application from an institution with a unique identity number is allowed, and only new applications are allowed. The OER glossary and the application guide provide further details. Here also is a link for the frequently asked questions. Organization eligibility. To be eligible for this Notice of Funding Opportunity, or NOFO, the applicant institution must be a National Cancer Institute NCI designated cancer center with a substantial and documented history of demonstrating partnerships with Indian tribes, tribal organizations, or urban Indian organizations, particularly those living in rural communities. This is a U19 funding mechanism, which includes multiple components. The following components are required for each center: the overall component, the administrative core, maximum of 1, the community engagement core, maximum of 1, and the research projects, maximum of 3. For the overall component, describe the specific aims of the overall U19 center. Summarize the design and structure of the U19 center, its focus, features, and functions of the proposed cores, and how the center will broadly advance empirical knowledge about improving cancer outcomes in American Indians and Alaska Natives. Without repeating information in individual biosketches, describe the proposed comprehensive, multidisciplinary approach and explain how the collective expertise and experience of the investigators will support the team science environment needed to complete proposed work. Provide an overview of the proposed research projects and how they were selected for inclusion in the center, and describe the plans and procedures to monitor and assess progress on those projects. Describe plans and procedures to monitor and assess progress of the U19 Center. Overall component continued. Letters of support are also required from tribes and tribal organizations that describe the history of the partnership in collaborating on prior mutually beneficial activities, the mutual understanding and cooperation among the partners, and the relative contributions to the previous projects. Academic or community-based partner organizations and entities that specify the nature of collaboration and role in the project. An institutional official endorsing the proposed center and that describes the available institutional resources that will support its activities. Data management and sharing plan must be provided in the overall component. Other attachments. The applicant must include a single attachment titled Institutional Information that provides a detailed description and evidence of the institution's history of demonstrating partnerships and collaborations with American Indian and Alaska Native tribes, tribal organizations, and urban Indian organizations, particularly those living in rural communities. The administrative core provides administrative and logistical support for all center activities. Applicants are encouraged to include an evaluation plan and plans for developing or utilizing existing data standards and using common data elements, or CDEs, and measures across research projects as applicable. These include CDEs from the Social Determinants of Health collection of the Phoenix Toolkit, with flexibility to adapt to culturally respectful and acceptable approaches. In addition, career enhancement activities such as seminars, workshops, and other activities may be provided to investigators at the applicant institution or partnering organizations to promote the recruitment, advancement, and retention of investigators focused on American Indian and Alaska Native cancer outcomes research. Community Engagement Core. Applicants must describe activities designed to enhance and sustain existing long-term relationships with the community-based tribal organizations built on the foundation of mutual trust to address their community's health-related concerns. The Community Engagement Core is expected to work closely with American Indian and Alaska Native organizations on designated reservations, off-reservation lands, in rural areas, and urban communities. The Community Engagement Core also needs to leverage the network of tribal organizations and the established clinical settings that work with the Cancer Center to coordinate access to diagnostic evaluations, initiation of treatment protocols, and comprehensive follow-up care for American Indian Alaska Native individuals in their catchment area and referred for care. Direct funding of research projects is not allowed under the Community Engagement Core. Research projects. Research with American Indian and Alaska Native populations must be conducted in a community-engaged manner, where the tribe or tribes are appropriately involved to ensure the cultural appropriateness of the outreach strategies, intervention, study design, and overall approach, and tribal ordinances and codes are followed. Minimum of 2 or maximum of 3 research projects must be proposed that 1, clearly identify specific cancer or cancers for which there is need for intervention. 2, articulate a process for ensuring cultural appropriateness and/or recognition of community strengths and resiliencies. And 3, advance knowledge in addressing cancer overall and/or specific cancer types through etiologic research, prevention research, treatment or dissemination and implementation research. Investigators are also encouraged to consider culturally unique etiological factors or targets for interventions, relying on culturally relevant theories to frame research, considering culturally specific worldviews and indigenous knowledges as they relate to the research approach and design, culturally sensitive research processes, and culturally appropriate measurement strategies and processes. Proposed research projects should provide letters of support for the project from tribal officials or from the governing body of the urban Indian organization where applicable. Projects may be led by investigators of any rank. The results of the listening sessions and consultation with the Tribal Health Research Office helped shape the specific areas for this initiative, which will support efforts including research, education, outreach, and clinical access to improve the screening, diagnosis, and treatment of cancers among American Indian and Alaska Natives, particularly those living in rural communities. Potential areas of focus may include, but not be limited to, developing or adapting and testing innovative outreach and educational strategies to promote cancer prevention, screening, and early detection, developing or adapting and testing innovative outreach and educational strategies to promote access to high-quality cancer treatment, opportunities for participation in clinical trials, and adherence to follow-up protocols after initial treatment. Interventions seeking to address challenges with cancer treatment or adherence, such as financial hardships, caregiver availability, or access to treatment facilities. Research on strategies to increase access to preventive services, cancer screening, and direct clinical care at NCI-designated cancer centers' clinical settings. Specific areas of research interests may also include, but are not limited to, interventions that increase rates of follow-up surveillance after completion of initial treatment, referrals to supportive care for cancer survivors, and developing interventions for cancer survivors that include integration with community organizations. Testing healthcare delivery approaches that are culturally appropriate and strengthen self-management of clinical outcomes, combined with appropriate surveillance of adverse social determinants of health, such as transportation or financial strain, and/or address comorbid conditions that affect outcomes, such as anxiety, depression, substance use, diabetes, hypertension, and other chronic conditions. Research on cancer treatments grounded in indigenous knowledges, including traditional medicines or other holistic healing approaches for mind, body, and spirit that can be incorporated into an overall treatment plan for patients. Development, adaptation, or testing of community or structural level interventions focused on addressing the health impacts of environmental carcinogens, including exposures such as radioactive areas, arsenic levels in water on the Great Plains, or uranium mines in the Southwest as some examples. Multi-level intervention research to improve the screening, diagnosis, and/or treatment of cancers that incorporates risk and resilience factors in the context of environmental, social, economic, and/or cultural determinants of health. And finally, specific areas of research interest may include, but are not limited to, impact of behavior change, survivorship and quality of life, resilience, positive assets, long-term side effects and pain management among cancer survivors. Focus on lifestyle interventions that can be implemented after diagnosis and treatment to include smoking cessation, physical activity, and meditation. Interventions targeting social, environmental, or behavioral determinants of health that may contribute to risks for developing cancer or for progression of diagnosed cancer and related complications. And finally, studies of innovative or novel strategies designed to deliver comprehensive, coordinated, high-quality cancer-related care within rural communities, such as more extensive use of telemedicine and other technologies to provide clinical care. Ethical standards, sovereignty, and self-determination. Researchers must uphold rigorous standards to ensure ethical and respectful practices, recognize the sovereignty and self-determination of American Indian and Alaska Native communities, requiring meaningful engagement and partnership throughout all stages of the research. Ensure that prior informed consent protocols be culturally appropriate and tailored to the specific needs and traditions of each community with clear communication about data usage and potential implications. Prioritize data sovereignty, acknowledging that American Indian and Alaska Native communities have inherent rights to their information and must have a say in its ownership, access, and application. And robust governance structures developed in coordination with tribal leaders and community representatives are essential to guide the ethical use of genetic data, ensuring that research aligns with tribal laws, ordinances, and codes and protocols when tribal laws or ordinances are absent, as well as community values and priorities, while safeguarding against exploitation or harm. Now let's talk about the award budget. NIMHD intends to commit $6 million total costs in fiscal year 2024 to fund up to 2 awards. Budgets are limited to $2.5 million or less in direct cost, excluding consortium F&A costs per year. The maximum project period is 5 years. This initiative is a partnership between the NCI-designated Cancer Center and tribes and tribal organizations. There is an expectation that appropriate budgetary support will be included in the application to those entities. Now for Part 3, Peer Review of Applications. Dr. Marilyn Laud will now discuss this section. Dr. Laud, the floor is yours.
So when your U19 application arrives, it will be assessed for completeness by the Center for Scientific Review, CSR. The NIMHD program staff will assess the application for responsiveness, which is based on the eligibility criteria in the RFA. And the NIMHD Scientific Review Officer who will assemble a panel of experts from the extramural community to peer review the applications. Next slide. The preparation for the peer review. First, we look at the RFA specific characteristic and the review criteria. There is the overall program goal, mechanism characteristics specific to the RFA, and the review criteria that are specific to this RFA that you can find in Section 5 of the RFA. And in addition, there is some additional review criteria consideration, such as human subject or budget. The administrative review of the application. For the RFA has some requirement. So whether the applications are complete as required by the RFA and have the appropriate section to be able to be reviewed, which personnel are involved in each application and their institution affiliation, and the specific aims stated in each application and the expertise needed. This is the way that the reviewers will be chosen. Next slide. So again, reviewer selection, scientific expertise defined in the RFA, and the collective content of the application, but we also take into account the diverse representation of opinion based on gender, demographic, and geography. Next slide.
Sorry, Marilyn, I was just having a little trouble. I'm just going to move to the next slide. And I will be putting a PDF of the slides in the chat. It just looks like maybe some folks are not seeing them. So sorry about that. And thank you for your patience.
So the peer review process, first, so there is a pre-meeting. The reviewer will submit the written opinion, their written opinion and critiques. And there is during the meeting,
unknown caller.
During the meeting, the reviewers will discuss the application and vote the overall impact and final score. I have here that some application may be streamlined, which means non-discuss. So the application may undergo a selection process in which only the application that have a higher scientific and technical merit, generally the top half of the application under review, will be discussed and assigned, and this application will assign an overall impact score. Next slide, please. The reviewer will evaluate the whole application potential for success. The overall impact score is the consideration of the scientific merit of overall center, evaluation of all core as a whole, and the research project, but not always an average of the multi-component. The administrative core and the community engagement core, the reviewer will provide their assessment of the likelihood for the cores to exert a sustained, powerful influence on the research field involved, and only one score for all these scores will be given. The criteria for the overall center and the research project, the overall impact has to reflect the likelihood for the center to exert a sustained, powerful influence on the research field. There are still 5 score review criteria: significance, investigator, innovation, approach, and environment. Next slide, please. There are additional review criteria that are included in the determination of the overall score. The study timeline, if there is a clinical trial, the protection of human subject, the inclusion of women, minority, and individuals across the lifestyle, and the biohazard. Next slide, please. There are additional review considerations. These criteria are not included in the determination of the overall, but they are discussed. So the select agent research, the data management and sharing policy, which the reviewer only see your budget, they don't see anything else. The resource sharing plan and authentication of key biologic and chemical resources, and the budget. There is no, so the budget doesn't count in the scoring, but the reviewer will have to consider the budget and say if there is a recommendation or so which way they want, they would like NIH to go. Next slide. The score, so the final impact score based on average of all the voting reviewers is multiplied by 10. The score range from 10, which is exceptional, to 90, which is poor. The score will be released in 72 hours after the close of the meeting, and a summary statement for all applications will be available approximately 30 days after the review meeting. Please do not contact the member of the review panel. So for your for this special RFA, things are going to go a little bit faster, and hopefully you will get the result also maybe before 72 hours after the meeting and less than 30 days after the review meeting. Next slide. So this is, there are videos on peer review topics, but I would like to add to this slide that please do not include any potential reviewer name in your in your application. If there is a name that you want as potential reviewers, they will not be invited, and so it can be a problem. And also, it's still not too late to send us a letter of intent if you want to apply. It will be helpful for me to see which center is coming. So if you didn't do it yet, please send a letter of intent. Thank you. Angela?
Thank you so much, Marileen. You may contact NIH, program, peer review, and grant administration. Contacts are included in the last slide of this presentation and in the RFA. And we are working on getting that PDF to upload to the chat. So we will be getting that to you as soon as we can. So I will go on now to explain part 4. Timeline for submission, review, and selection process. The letter of intent due date was July 2nd, 2024. The application due date is August 2nd, 2024. Scientific merit review is August 2024. Advisory council review is September 2024. and the earliest start date is September 2024. For the review and selection process, applications will compete for available funds with all other recommended applications submitted in response to this notice of funding opportunity. Following initial peer review, recommended applications will receive a second level of review by the National Advisory Board Council on Minority Health and Health Disparities. The following will be considered in making funding decisions: scientific and technical merit of the proposed project as determined by scientific peer review, availability of funds, relevance of the proposed project to program priorities, and geographic distribution of awardees. Part 5, selected frequently asked questions and participant questions. The video and slides will be posted on the NIMHD website within 1 week. And now Dr. Nathan Stinson will be answering selected frequently asked questions and taking your questions sent to the webinar chat. Dr. Stinson, the floor is yours.
Thank you very much. Why don't you go ahead and go to the next slide? Yeah, so one of the questions that we got earlier, and Dr. Fernandez did mention, is the budget of $2.5 million for the entire 5 years or per year. And as she mentioned in her presentation, the budget is $2.5 million in direct costs, excluding the consortium F&A per year. And we issued a notice of correction for the NOFO, just to make that very, very clear. Next slide. Another question that we got, should project roles for core components of the application be referred to as project lead? For all of you that are used to using the ERA system and assist, especially for multi-component grants, it is rather complicated, as far as following the instructions. To make it clear, we issued a notice of correction to inform applicants that when they are filling in the template for the core, like the administrative core and the community engagement core, the system defaults to project lead, but we want them to put in their core lead, just to make a distinction between the PI of the entire project. Another question that we received, do the research projects in the U19 need to be up to 5 years? For example, can some be 5 years and others be fewer years only? The notice of funding opportunity doesn't state in required length of time for any of the research projects, only that the maximum project period is 5 years. So that's totally up to the discretion of the applicant to determine the length of time for the project period. We do also reinforce to applicants that you just have to make sure that the proposed activities of the research project can be achieved in whatever time period that is stated as a project period. Next slide, Angela, or those are the questions? Okay, another question that received ahead of time. Will the recording and slides be made available online? The answer is yes. The recording and the slides will be posted on the NIMHD website as soon as we can after the webinar. Also put in the chat a copy of these particular slides. Okay, so please, put in questions that you have into the chat. There was a chat that asked, was there a reason the turnaround time between the release date and the due date was so tight? We are aware that that the timeline for submitting applications is extremely short, especially for applications that are, multi-component. The things that kind of impacted ability to get this NOFO published is that the appropriations bill was passed relatively late in the year, at the end of March. And it was also, more importantly, it was important that for us to really go through the appropriate process of tribal consultation in working with the National Cancer Institute around the particular content of this. We wanted to be very direct, very transparent, and very open with with tribes about what we were thinking about, and taking into consideration any suggestions that they basically, were thought that was important. As Dr. Fernandez mentioned, we had some listening sessions, but we also organized and arranged a national tribal consultation, all of which basically, took time. So we are aware of the short timeline to basically do that. We understand the demands and the stress that this puts upon you, in really developing your applications. And we just have to say we appreciate your understanding, and we certainly appreciate and respect all the effort that you will have to go through to really put in an application. There's another question in the chat that says, our letters of support required in the administrative core. When we letters of support are basically required, and you should just follow the instructions in the NOFO that really talks about where to put the letters of support. It isn't necessary to continue to repeat the letters of support over and over and over again in every particular section of the NOFO. Well, since we're waiting to see if anyone has any other questions, I'll just elaborate a little more on the last question. Letters of support are required in the overall section. We thought it was important to make sure that there that the support was there for the overall efforts of the center as a whole. And also letters of support, are required for the research project section of the application as well. We required it in that section because we wanted to be very, very clear, and we wanted to make sure that applicants were in engagement with the relevant tribes, and that there was support and agreement about the particular research projects that were being proposed in the application, and this is all spelled out in the instructions in the NOFO. There's a question that says, is there a specific template or, a format for the institutional information that provides a detailed description and evidence of the institution's history of demonstrating partnerships and collaborations with American Indian, Alaska Native tribes, tribal organization, and urban Indian organizations? No, there's not a specific template or format that one needs to basically use. Most important thing is the content, not how you really structure it as a other attachment. So another question is, could you speak to the role of the Cancer Center and how we might, emphasize the unique strengths of the center for this RFA? In other words, why NCI, a cancer centers? As we mentioned in the notice of funding opportunity, this particular initiative is supported very specifically by congressional language that was in the in the appropriations bill that was passed earlier in this year. the intent of that particular language was to recognize that there are NCI designated cancer centers who have established and long-term partnership with tribes and tribal organizations for the services that they provide in their particular center. And Congress was interested in building upon existing relationships that have been ongoing, but could certainly benefit from having additional resources in a way to really enhance the activities and to reach American Indian, Alaska Native population to a greater degree than what is occurring right now. And so I think there was a sense that there's certain economies of scale, meaning that the infusion of resources to expand upon or develop new interventions based on some already establishing research structure would allow more funds to go directly towards addressing the issue around cancer outcomes in American Indian, Alaska Natives, instead of trying to build something new and then try to address those particular concerns. And so I think that's where the connection came from, having this initiative be housed at an NCI designated a cancer center. Another question is, are the historical relationships with tribal organizations required to be with the excuse me, my chat, they seem to be moving when additional questions come in. Are the historical relationships with the tribal organization required to be with the institution or investigators who may be changing institutions? Not sure I understand the second part of that particular question about investigators who may be changing institutions, but the expectation is that the applicant organization has to have a history of collaboration and partnerships with the tribal organizations. Any other questions that anyone has? Okay, well, I want to thank everyone. And Angela, do we have one more slide there? Yes, this is kind of our slide that shows the contact information for Dr. Fernandez and myself. Also, the peer review office and grants management. These are also all in the notice of funding opportunity. And once again, let me thank all of you for your participation in this technical assistance webinar. More importantly, for your interest and commitment and work that you are doing currently with American Indian, Alaska Native, populations, whether it is specifically related to cancer or other health conditions that unfortunately the disparities exist. And Dr. Fernandez, are there any last comments you would like to make as well?
Yes, thank you, Dr. Stinson. Just wanted to say Match and thank you very much. Just as Dr. Stinson said, we very much appreciate your very hard work in the short time period, and we really look forward to any questions that you have. So please contact us. Don't hesitate. We're looking forward to your questions. And again, Match and thank you so much for all that you do.